How does CBT help you deal with depression? CBT stands for Cognitive Behavioural Therapy. It's a type of talking therapy that can help people with lots of different mental health conditions, including depression. CBT is recommended by national guidelines for treating depression. They're based on research that has found that it's effective, that it can have a big impact relatively quickly, and that other young people have found it helpful. It isn't always the right fit, and there are other therapies that you can try if it doesn't help, but CBT is usually the first thing that you're offered. One of the main ideas behind CBT is that our thoughts, actions, bodily sensations, and emotions affect each other. It helps you explore how this happens for you and think about what you could change to help you start feeling better. For example, if you're not invited to a party, you might feel sad or rejected. You might have thoughts like, nobody likes me, or I'm useless, and you might feel tired or sick. And as a result of all of this, you might retreat into your room, stop responding to messages, and get stuck thinking about the situation over and over again. We can understand all of that as a natural response, but it's likely it might mean you end up with more difficult thoughts and feelings, further isolating yourself and feeling worse and worse. In CBT, you might recognize that not being invited was sad, but think about how you can interrupt that spiral of thoughts and feelings and actions to reduce the negative impact on your mood and well-being. It's important to say that when we explore making changes in CBT, it doesn't mean that depression is your fault or that you should be able to manage it on your own. It's okay for someone to help you find a bit of perspective, to reflect back what you're thinking, and to talk with you about the different things you could try. CBT usually focuses on two things: changing our actions and challenging our thoughts. One of its benefits is that your therapist can introduce you to lots of different practical strategies depending on your situation. It doesn't focus on trying to directly change how you feel, because our emotions aren't something we can control. This doesn't mean that they're ignored. You'll spend time thinking about how you feel, and for some people, this might include working on identifying and expressing their feelings. It's just that the focus is on what you do. With your therapist, you'll get to work out some specific goals, and every session of CBT gives you helpful things to try as you learn more about yourself, what's going on in your brain, and what you can do to feel better. You might think about whether you have any thinking patterns or styles that contribute to your low mood, which might involve using a journal or app between sessions. Together, you might then try different ways of challenging your thoughts. You might put a thought on trial and look at the evidence for it being true and the evidence for there being another way of thinking about the situation. Or you might do an anonymous survey with your friends and other people who work in the mental health service to see if other people think in a similar way to you. You might also try out some behaviour experiments where you do something differently and see if it changes how you feel. This might be linked to testing a belief, like going to a party rather than avoiding it, to test out a belief about what will happen if you go out and spend time with friends. Or this might involve trying an activity to see if it helps your mood. You'll choose activities with your therapist depending on what's important to you, often thinking about things you might have enjoyed before depression. You might also try something called behaviour activation, where you do an activity with your therapist during a session to see if it has a positive impact on your mood. When you have depression, it's difficult to find the motivation to try new things, but we know that motivation doesn't usually just appear. It comes from doing activities that help us start to feel better. Your therapist will understand how difficult this is, and they can help you think about how you might break a task down into smaller steps and tackle any challenges you might experience along the way. Depression can be really hard to overcome. There can be setbacks and hurdles, and it's common for your mood to go up and down even when you're having therapy. But we know that it is possible to get through depression and enjoy life again, and that for a lot of people, CBT is a really helpful and important part of their recovery journey. And it gives you techniques you can use throughout the rest of your life, even after you've finished your sessions. Lots of CBT therapists use things from CBT in their everyday lives when they're facing challenging situations. For more information about depression, CBT, and coping, head to the Best For You website.